Hi there, this is Diane Mapes from Fred Hutch News, coming to you today with the Fred Hutch podcast from bench to bedside and beyond with a special guest, Dr. Trang VoPham. Trang is an epidemiologist with Fred Hutch's Public Health Sciences Division. That means she is a disease detective. So she studies the different factors that can lead to diseases such as cancer. Dr. Trang VoPham, welcome. Can you tell
Thank-
me a little bit about what you study at your lab?
Sure, of course. So I'm principal investigator or PI of the Geospatial Exposome Lab or GeoX Lab. And we conduct a series of epidemiologic and translational projects looking at the role of environmental risk factors on disease. And we use geospatial science technologies or location-based technologies to do so.
Can you just talk a little bit about some of the exposures that you've come across and how they can impact us?
We have conducted a series of epidemiologic studies or among human populations looking at the role of different environmental exposures in relation to disease. This includes air pollution and wildfires, for example. In one specific example, we published an epidemiologic study last year where we linked geospatial data on air pollution and wildfires, both derived from satellite imagery, and we link that information with cancer registry data. So, cancer patients across the US. And we were able to show that the association between air pollution exposure and risk for dying from cancer among cancer patients was stronger in areas that were more heavily impacted by wildfires. So, that's one example of one of the studies that we conducted.
That's that's news we can use.
Yeah.
As a cancer survivor myself, it's good to know that something like wildfire smoke, and we get a lot of wildfire in the Pacific Northwest because we have also many beautiful trees. But it's good to know that that could be put me at risk, maybe
Yeah.
for metastatic recurrence. Some of the things that you study are unexpected exposures, and one of them has to do with light exposure and especially light at night and how much the circadian rhythms of the body can be disrupted by light. So, can you talk a little bit about light exposure and circadian disruption and some of the findings that you have there?
Just for some context, a wide variety of biological processes, such as sleep timing, are driven by circadian rhythms. And the timing of these approximately 24-hour rhythms is primarily set by the timing, intensity, and duration of our exposure to light. So, light is very important. And when the time in our body is not aligned with what we're doing, for example, being awake at night and then sleeping during the day, which is required for shift workers. This results in what we call circadian disruption, which negatively impacts health. And so, shift work is a type of circadian disruption, and solar jet lag is another specific type of circadian disruption or circadian misalignment. And solar jet lag, it's defined as the difference in light exposure experienced by people based on their geographic location within a time zone. So, for example, suppose we have two people, one person living in Seattle, Washington, and one living in Spokane, Washington. Despite both of these places being located in the same time zone, right, in the Pacific time zone, in early March, someone here in Seattle on the western edge of the Pacific time zone experiences a sunrise and a sunset more than 20 minutes later than someone in Spokane, Washington, who is on the eastern edge of the Pacific time zone. And so the relationship of the body clock relative to standard work hours for these two people who are located on the western versus eastern edges of a given time zone is quite different. And this can lead to a chronic state of circadian misalignment, which has been associated with adverse health outcomes, one of which being hepatocellular carcinoma, or HCC, which we will be investigating in a new American Cancer Society Research Scholar Grant.
So when you were talking about solar jet lag, most of us here recently just had to change our clocks, right? We lost an hour and it leaves a lot of people feeling discombobulated,
Mhm.
you know? So this is sort of discombobulation of the body that can disrupt it on a system-wide basis.
How I would approach answering that is, we've seen in experimental studies, such as in animal models, for example, showing that in general, circadian disruption promotes the development and progression of liver disease and HCC. And our sleep and circadian collaborators have pointed to circadian regulation being a major determinant of liver physiology. So, similar to other organs, the liver has an internal circadian clock and timing system that adjusts physiological processes to their relevant time of day. And there are advantages. For example, we metabolize food more efficiently during our biological day, and disruption of the circadian clock, such as due to shift work, due to solar jet lag, leads to dysfunction of circadian clock controlled cellular processes and molecular pathways, which has been linked to the pathophysiology and progression of liver disease, as well as for risk factors for HCC, such as diabetes, obesity, metabolic dysfunction associated steatotic liver disease, or MASLD. And there have been epidemiologic studies, so among human study populations, including one that we published in 2018, showing that solar jet lag is associated with a higher risk for developing HCC. However, this prior work, it was based on a relatively crude way to measure solar jet lag. And in this new American Cancer Society grant, we will be leveraging our newly developed high resolution geospatial model for solar jet lag. And we will be linking that model with geocoded residential addresses of VA US veterans. So the precise locations of where these patients have lived over time, which will improve our ability to investigate the impact of solar jet lag exposure on HCC risk.
So it
Yes.
will give you a really good idea as
Mhm.
to the impact of solar jet lag on these patients. So you're going to just be starting this study and then it's going to run for probably a few years.
This is awarded this year, 2026, and it'll be running through 2030.
We can do things to prevent this with solar jet lag. It's not like you're just stuck living in the wrong time zone.
Yes. So there are definitely ways to modify exposure to solar jet lag. You do not have to move to a different location in a time zone. Some researchers, so they have described having a healthy light diet. So optimizing your intake and timing of exposure to light to promote health and well-being. So for example, a person could time their exposure to light at appropriate times of day. So bright light in the morning and avoidance of light in the evening. Behavioral and environmental modifications such as window shades and eye masks can limit exposure to light at night. Practices optimizing sleep timing, duration, and regularity are beneficial for health in general. And limiting nightly use of blue light devices such as phones is also an option. And intervention, yes, interventions at the policy level that have demonstrated reductions in circadian disruption include flexible or hybrid work hours, as well as delayed school start times to facilitate the alignment of social and or work commitments with biological time. So for example, in 2022, California became the first state to pass a law requiring high schools to start no earlier than 8:30 a.m. and middle schools to start no earlier than 8 a.m. So there are definitely ways to address circadian disruptions spanning the personal to policy levels.
I would think that any shift workers or folks who have a tendency to stay in bed for 3 hours looking at their phone before falling
Mhm.
asleep may want to hear some of this too. I never realized that light disruption and circadian disruption could have such a harmful effect on the body. So, is there anything else that you would like to share with the audience about your work, or any other unexpected exposures that people might want to think twice about?
Sure. So our lab has been doing more translational work or thinking about how we can go about using knowledge gained from epidemiologic studies on etiology, so on disease risk factors, to creating actual real change to promote population health and improve health and well-being through designing and implementing strategies for population wide and individual level disease control programs and policies. So, for example, our lab has been developing the geospatial exposome map or GeoX map. It's a new geospatial tool to support community outreach and engagement work in the Fred Hutch Cancer Center. So, in particular, GeoX Map, it will be a geospatial web app that we aim to launch this year that will allow people to learn about neighborhood level health and environmental data. This includes information on air pollution, on wildfires, radon noise, green space, cancer burden, and many more. And in addition, to promote disease and cancer prevention and control efforts, this web app will include actionable, practical tips with links to evidence based strategies for exposure mitigation of modifiable risk factors, such as where and how to access free radon test kits to lower lung cancer risk. So, more
And most
detail.
people don't realize that right after smoking, radon is the number 2 cause of lung cancer.
Radon is a very important risk factor. Absolutely.
Yeah.
So,
So it's really important to know if you have that in your neighborhood or in your house. And with your GeoX map, that kind of information can be gleaned. Also, people live in urban heat islands where there's no shade.
yeah.
And people may not realize the importance of having trees and shade and green spaces and blue spaces too for their health. So
Mhm.
it's fascinating that you're able to dig into the environment and find things that we should avoid and promote the things that can help our health. Now, with the
Yeah.
GeoX map, if you find that you live in an area like an urban heat island, what
Mhm.
would you tell someone?
Well, a person using GeoXMap will be able to view at a pretty granular neighborhood level information on temperature, for example. And then we will be including for the temperature data tips on how to access extreme heat cooling centers, for example. So there's actionable information associated with viewing that information. But it's really like I think of it as a launching pad. So you can learn more about your neighborhood environment. And from there, I mean, if you want to look at it further, you can reach out to us and we can point you towards, other data sets. You could do a deep dive, so on. So yeah, it's many different target uses that we have in mind.
Mhm. Well, it's empowering people to,
Definitely.
take control of their own health and
Yeah.
be able to take action to improve their health, which is great. And basically is what Fred Hutch's Public Health Sciences Division is all about,
Yeah.
is empowering people to live better, healthier lives. So that's
Yes.
wonderful. One of the things that can drive you nuts when you're diagnosed with cancer is, where did this come from? Why did I get this cancer? And
Mhm.
so epidemiology, that's what you're doing. You're digging into the why of cancer. And I think that having answers like that can really be helpful for your own peace of mind and also be able to share that with others too, that maybe there's something you can do so you won't get this cancer. So I really applaud that work, and it's not easy.
I think that this research program, this line of work can be very valuable because, as we've discussed, there's a modifiable aspect. There's a part of this that is within your control. Should we demonstrate, in this American Cancer Society's funded study, for example, that solar jet lag does indeed increase risk for developing HCC, there are steps that you can take as a person to lower your exposure to solar jet lag. And then I'm an epidemiologist, but I have the honor of working with really wonderful clinicians. For example, Dr. George Iwanu, he's director of hepatology at the VA Puget Sound Healthcare System. I work with other clinical hepatologists, Dr. Nicole Kim, Dr. Philip Boutian at UW Medicine. So they really enhance this work by providing context and expertise, with the liver cancer, the clinical side of this. So I think that's one of the many reasons why this research project, I'm so excited about it and it's so strong.
So, Dr. Trang VoPham, thank you so much for joining us on Fred Hutch's Bench to Bedside and Beyond. Really appreciate your work and congratulations again on the grant. It's great
Thank you
work.
so much. Thank you.